So I'd like to tell you a little bit about our shelter study of Panleukopenia virus. We did this last year, and there was a very shelter-aware and interested veterinarian from Thailand called Dr. Chutamas, who came to visit the Maddie Shelter Medicine program at Purdue. She wanted to engage in some practical research, and she went to Port Chicago and did a records review of all of the cases of Panleukopenia over 10 months in October, from January to October 2010. So she pulled all the files from cats that either had Panleukopenia or were in contact with cats that had Panleukopenia. And there were about 145 cases all told between the ones that actually had the disease and the ones that were in contact. We've divided all of the cats in the study up into 3 groups in a traffic light sort of system, which I've colour-coded later on in the presentation. So group 1, these were green. They get to go. Everything went okay for them. They were in contact with cats that were known to have Panleukopenia, but they did not get any signs of disease at all. So group 1, there were 66 cats, and we know that they were in contact with those affected cats because they were littermates, or perhaps they were mothers of kittens that had Panleukopenia virus. As it turns out, there were antigen tests done on fecal antigen tests done on 44 of those 66 cats, and 44 of them were negative. They were all negative. So group 2, yellow in our traffic light system, these cats had mild to moderate disease. We know that they had Panleukopenia virus because their fecal antigen test was positive, and that they did have clinical signs of Panleukopenia virus, but they lived. There were 27 of those cats in our study. Group 3, unfortunately, they were the red in the traffic light system. There were 52 of these cats. They had severe disease and they died. We know that they were antigen positive, fecal antigen positive, and that they showed severe clinical signs of Panleukopenia virus, and unfortunately they did not survive. So this table is just a little summary of a description of what those cats looked like. You can see that first row, how old they were at intake, and they were all pretty similar ages. Again, that traffic light system with group 1, the ones that were in contact that didn't get disease, in that first column. Then group 2, they developed mild disease in the second column, and in the right-hand column there were group 3 cats that died of the disease. And along that second row there, they were the pretty similar ages. They were dominated by kittens, as you can see. The row below that, there were 79% of that group 1 were kittens, 70% of group 2 were kittens, and 85% of group 3 were kittens. And by kittens in that case I mean less than 6 months of age. We got the usual sort of shelter breed mix, which is not much of a mix. Most of them were domestic short hair, and there was a mix of genders as well. One interesting finding was that we grouped them by whether they were owner relinquished or they were strayed, and we got a pretty similar mix of owner relinquished and stray cats in each of those groups. There was a seasonality, as you would expect, in a disease that is dominated by kittens. So you can see over the summer months we had more cases. It's interesting, in January there seems to be a peak as well, and I'm not quite sure about that, whether there perhaps was an overall larger intake into that particular shelter in January, so proportionately there's going to be more cats that were infected with Panleukopenia virus because there was a larger intake. I'm not quite sure, but certainly there does seem to be a bit of a seasonal peak in the summer. We wanted to have a look at moms and kittens as well, because there's often a question in a shelter, do I keep the mom with the kittens or not? We're never quite sure what to do once you're starting to see signs of Panleukopenia virus. So in this particular population that we studied, we had 66 kittens that were 3 to 6 weeks of age in 8 litters. Okay, so these were the sort of ages where you're thinking about, do I keep mom with the kittens or not? There were 36 of those kittens that were housed with their mother and their litter mates, and 30 that were housed just with the litter mates only, no mother. And we had 8 queens that were housed with litters. They were estimated ages 1 to 3 years. So I'd just like to show you this graph. I think perhaps gives us some ideas about this conundrum of whether we keep the mother with the litter or not. Again, it's a traffic light system. So we've got here on this x-axis here, firstly, this bar is the bar for the group that was kept with their mother, and the next one was kept without their mother, and the next one was the mothers themselves. And we've broken each bar up by proportion in the traffic light system that I was telling you about, by the percentage of the group that were either group 1 that didn't develop any signs of disease, group 2 in yellow that were infected but developed just mild to moderate signs, and group 3 that died of the disease. And what I take from this graph is that there were an awful lot of moms by proportion that were in fact succumbed to disease. So about half of the mothers in this study died of the disease themselves. So no wonder there's not much of a difference in the proportions of kittens that are in each group when you compare whether they were kept with their mother or not, because it seems like, yes, being with mum might be a good idea because the mother provides them with milk, which could be a source of antibodies and support and comfort and all those wonderful things. However, it seems that she's often a susceptible animal herself, and she can die of disease. So she could be a source of infection for the litter. So it's really, I think that if the kittens are, if the mother is healthy and she's fully vaccinated, then I think it's a pretty good risk to leave her with the kittens. But if she's not healthy, if she's showing signs of disease, you might really have to weigh up the risks and benefits of keeping the mother with the kittens.
Did you say that a higher percentage of mothers are dying than of kittens?
Yes, so the question was, that graph looks like there's a higher percentage of mothers that died than kittens. And yes, in fact, that's what happened in this population of 145 cats. There were only 8 mothers. So, you know, when you've only got a small number to deal with, that's the sort of thing that can happen when the numbers play out. So, diagnosis. This is our mainstay of diagnosis. You can see the photo there at the top right of the slide is our fecal antigen test. We put that together with a history of possible exposure, also appropriate clinical signs, and we're going to present the clinical signs that were seen in this studied population in a later slide. What we should know about that fecal antigen test is that there can be false negatives and very, very occasionally false positives. So false negatives can occur up to about a quarter of the time, because the test detects antigen in the faeces. So parvovirus antigen in the faeces. You use the canine test that has now been validated for use in cats as well. So it gives good, accurate results in cats as well as dogs. But they don't always shed the virus. So if they're not shedding the virus, they may be infected, but that test reads negative. It is possible to get a false positive after vaccination. And it doesn't matter whether it's killed vaccine or modified live vaccine, and it can happen 1 to 14 days after vaccination. But I don't want to overstate this, because these false positive results are rare, and it depends a lot on the brand of test that you use. The IDEX SNAP test is the one that is least likely to give these false positive results. So it's probably, these false positive results are really rare, maybe as low as 1%. Blood smears are a good adjunct to diagnosis. Perhaps you've got a case here that you think is Panleukopenia virus, but the antigen test is negative, perhaps because of intermittent shedding. So if you do a blood smear and you see leukopenia, especially neutropenia, so you're not seeing neutrophils, you may well be able to make your diagnosis with that. The leukopenia you'll see about day 4 to 6 after the onset of clinical signs, and it can also be caused by other diseases such as salmonella or even leukemia virus. So panleukopenia is not the only cause of leukopenia, but if you put that together in an animal that has an appropriate history and clinical signs of Panleukopenia virus, and maybe the fecal antigen test as well, then you should be able to make your diagnosis. So Dr. Rose Raskin from Purdue Veterinary Medicine made this slide for me, and this is the sort of thing that you're going to see with Panleukopenia. So you can see here on this blood smear, there's just all of these red blood cells, and it's pretty boring, isn't it? There's just this one lymphocyte here in this corner and another lymphocyte there. That's the sort of picture you're getting with Panleukopenia. Usually you would have more white cells in a smear with that many cells in it, but it's just a blank out of red blood cells because the virus has worked on the bone marrow and the white blood cells just aren't being produced. So, talking about timelines, what happened in this particular population with the timeline with the fecal antigen test? They did use SNAP tests, by the way, with this particular population. And we've got just group 2 and group 3 here. Those are the two columns. Because, like I was saying earlier in the presentation, group 1 cats, the ones that did not show any clinical signs and did not have disease, were all antigen negative. So group 2 and group 3 were all antigen positive. That's how we knew that they had the disease. And the number of days from a positive fecal antigen test to the onset of clinical signs. Now, I broke this group up because it was really dominated by this 0 days, okay? So there were 16 out of 21 that were tested because we were prompted to test by clinical signs of disease. There were some cats that were tested before the clinical signs developed, some cats that were tested after, not very many, but most of them, 16 out of the 21 that we had records for, were tested just prompted by the clinical signs of disease. And again, 32 out of 39 for this group 3. For these cats in group 2 that were infected and lived, the number of days from the onset of clinical signs until they were healthy was an average of about 5 days. range of 1 to 9 days. And by healthy, I mean they're eating again and starting to show that they're interested in life, but they're eating voluntarily. Group 3 cats, the days from the onset of clinical signs until they died, median was 1 day. So that's the average was about 1 day, but it took anywhere between 0, really fast, and 9 days. So the question was, in some cats, was the antigen test done before clinical signs were shown? And the answer to that is yes. Sometimes it was done before any clinical signs were shown. And the reason that that was done was because perhaps that particular cat was known to be in contact with a litter mate that had shown signs of disease. So some of them were in contact, but they had no signs yet. They had a positive antigen test, and it just took them a day or two to start developing clinical signs. Others, there were a few of them there too, where they didn't become positive until after the clinical signs were shown, and there were some repeat tests done. So what were those clinical signs? Anorexia, so they weren't eating anything at all, they were depressed. They had a fever. Just a little note here, kittens run cooler than adult cats. So if they're 6 weeks or under, we're going to call it a fever if it's anything above 101. Whereas with cats and kittens that are over 6 weeks of age, it'll be the regular 102.5 degrees Fahrenheit. Obviously, a lot of them were dehydrated because they were vomiting, they had diarrhea. Sometimes there was blood in the vomit or the diarrhea. And there were often signs of shock, especially in these group 3 kittens that did not survive of the disease. They had pale mucous membranes, prolonged capillary refill time, so if you pressed on their gums and took your finger away again, it took more than 2 seconds for the gum to regain its colour again, and a lot of them were found collapsed or they were just found dead. This disease is severe and it's fast. So again, a table looking at the group 2 and 3 cats that were infected. The group 2 showed mild signs or moderate signs, and the group 3 cats did not live. So you can see that there were a lot of the cats that showed fever, dehydration, anorexia. One of the veterinarians at Paws Chicago said to me, I'm surprised that there weren't more than about 50% of the cats that were showing signs of anorexia, because usually that's one of the things that we're looking for is anorexia, they're not eating, in order to make us suspicious that perhaps Panleukopenia is coming. But I think sometimes the records weren't complete. So with any study, we're just reliant on the information that we can gather, and if nobody wrote anorexia in the file, then perhaps I wasn't able to count it. It just shows you what I was saying in the last lecture, how important records are, because you can build up these patterns, and pattern recognition is a really important tool in diagnosis. So we need to be able to write good written records of exactly the clinical signs that we're seeing. One thing that really jumps out with this table is this last row here. These really severe signs of circulatory shock where they get collapse, and in all cases where they showed signs of circulatory shock, they were pale and they collapsed, they died. Okay? There weren't any cats that lived of the disease that showed signs of circulatory shock. So what kinds of treatments did they use at Paws Chicago? They were all supportive treatments, because really there's no curative treatment for Panleukopenia virus. So obviously fluid therapy is really important. IV is great if you can get it. It's a bit difficult in small kittens, so a lot of the time it was sub-Q fluids. Covering with antimicrobials, antibiotics, such as doxycycline. Doxycycline is a good antibiotic to cover if there are signs of upper respiratory tract infection. So that might be one that you want to go for if you're looking for an antibiotic to cover these cats, because they've often got signs of upper respiratory infection as well. Antiemetics to stop them vomiting. Metoclopramide or dolucitron were used. Famotidine is an H2 blocker to try and settle their tummies a bit. And appetite stimulants, but these are really only of any use during the recovery phase. If a cat is really ill, it's going to be too sick for these appetite stimulants such as diazepam or mirtazapine to work. Have any of you used serum from an immune cat in kittens to try and protect the kittens? They didn't use it at Paws Chicago either, but just to let you know, and so it's in the notes for you, if you have unvaccinated exposed kittens that are still healthy, not showing clinical signs of disease, you can try and protect them using 2 mils of serum from a cat that's known to be immune. So that might be an older, fully vaccinated cat. And if you do that, you're going to have to delay vaccination in those kittens by 2 to 4 weeks, because it's going to have a high antibody titer that might interfere with vaccination. And you're going to have to continue the vaccination course on 2 to 4 weeks longer than usual as well.